Well, it is my honor and pleasure to introduce our next speaker for this session, Dr. Sima Rozati from Johns Hopkins University Hospital. She's associate professor there, specializes in cutaneous lymphomas and a variety of other things, and does amazing research. And I'm going to share the story because we talked a little bit earlier about the importance of supporting the young investigators, and I met Dr. Rozati. Oh my goodness, how long ago was that?
10 years ago.
10 years ago. She was our Young Investigator Award winner when we gave her the award at the World Congress of Dermatology, which was in Edinburgh, Scotland. And that was when we first met, and we had a dinner, and it was just supposed to be a small, very intimate dinner. I had made reservations. I had no idea what I was doing. And then all of a sudden, all of the clinicians said, well, can I come, and can I bring somebody? I think we got kicked out of the restaurant because they had a time factor, and they squeezed us in this little room, and we had all these people, and it was so amazing.
It was a really cute restaurant.
It was a cute restaurant. Yeah, it was really good. And she was leaving. She was in Zurich at the time, and she was leaving there to go to Stanford to do training at Stanford, and then came back to Hopkins, which was amazing because my physician, Eric Vonderheide, had migrated from Philadelphia to Johns Hopkins. I followed him there, and then he decided terribly to retire to Arizona, and we had no one. No one was there. So until Dr. Rozati came to Hopkins. So here we are, and now I'm going to turn it over to you.
Very good. Thank you for having me here, Susan. Okay, now I think it's working. And I usually am very loud. I don't need a microphone, but I think to some of you I explained I had an oral surgery and barely can talk. So bear with me, my voice can go in and out. So in this session, I wanted to talk to you about skincare. Couple of things. First of all, shout out to my fellows, Dr. Piera, Munjal, and Weiner, who put the entire slide deck together. They did an amazing job because they care for you all and our patients so much. And also keep it interactive. So feel free to interrupt me, ask question, raise your hand, shout out. So we make most out of this session in a way that benefits you. So, you know, this is, you might have seen some of this somewhere, layers of the skin, right? The very superficial layer of the skin, we call it the epidermis. And then the middle layer is the dermis. And the fat layer of the skin is the subcutaneous tissue. And as you see, there's a lot of other things going on, right? The skin gives us, you know, the heat regulation, temperature regulation, and the very that's for the deeper ones. Deeper layers, the superficial helps us with sensation, protection from outside environment, from the sun, and many, many other things. So it is very important that we try our best to keep it intact. And unfortunately, what happens with mycosis fungoides, Sézary syndrome, and many of the other cutaneous lymphomas is that that barrier is interrupted, right, by the disease, by the cancer cells. So one thing about it is that it's physically interrupted, right? And the other thing is that it is the cancer cells change the skin surrounding them. And so the skin, even if it looks normal, might not be able to function normal. So that's very important to understand the disease. And when you have your skin barrier disrupted, then you lose more moisture. So it's not only like that the disease is causing discomfort, but the side effects of the disease is causing discomfort because your skin is more dry. It's more prone to infection because of that barrier is not to protect you from outside bacteria. And also you lose a lot of heat when patients have a lot of skin involvement and all that barrier is disrupted. You lose a lot of heat from the skin. So that's why some of our patients feel always cold, okay? So part of, one thing about treatment is we want to minimize the disease and improve the quality of life of our patients. But the other part also is that, we want to make the skin, the barrier, the function of the skin as normal as possible. And that's part with CTCL treatment, and that's part with good skincare routine. So this is the overview of what we're gonna, go over. So in general, again, some things are related specific to this disease, and some things are just general good skincare regimen, regardless if you have the disease or not, or the disease is active or not, you should consider. And that's like, these are things that we already talked about, right? Reduce itching, improve skin texture and function, prevent infection, and reduce some of the side effects of the topical treatment that we use to treat CTCL. It can be like reduced with good general skincare regimen. We're going to start with cleansers. Cleansers, there's so many of them these days. I think one of my goals for today is less is more. Less ingredients in your soaps and your cleansers and your moisturizers, right? My best friend is a little bit of gentle soap and Vaseline. Like if you've been in my clinic, I love petroleum jelly. Like that is my best friend. And people want to hear more. They're like, what fancy thing it's out? That's as fancy as it gets. The rest is just marketing. I hope we don't have like moisturizing companies in here. But that said, we'll talk about it. It's not 0 and 100, but simply put, there's just a few things you need. So cleansers. So what they do is that really to try to get the dirt off, right? They are trying to basically loosen, right, unwanted bacteria and dirt and prior, like maybe moisturizers, emollients, whatever it is on your skin, off of your skin. So they can be really harsh. The ingredients for these cleansers can be very harsh, or they can be gentle. And, in general, like I'm thinking right now, and I'm like, when is it in my clinic that I would recommend harsh soaps ever, right? Never. Never do we ever recommend harsh soaps. Just because when you try to, with harsh soap, or harsh, like sort of what we call surfactants, get rid of like the dirt or bacteria, you are also getting rid of like the commensal bacteria, the bacteria that is supposed to be living with us. And you're getting rid of like the natural moisturizing molecules that are produced by the skin and are on the superficial layer of the skin. So a harsh surfactant never comes handy, okay? Sometimes, the cleansers, now this is like areas that if you want to get fancy, some of the cleansers, right, have a little bit of moisturizing ingredients in them. Again, you want to make sure you understand those. It's nothing fancy, no natural stuff. And I might get into it a little bit later because they can also irritate your skin. And this is basically what we're talking about. You can see in this little table here what we call mild surfactants and harsh surfactants. And we always try to go for the mild. soaps without fragrances and without really any extra ingredients. You know, I think a lot of this is intuitive, right? But when the skin has disease and it's irritated, it can get confusing because you don't know if like the general rules apply or not. So when you want to cleanse, you just, you know, it's like your face and body. You don't need to wash it really multiple times a day unless it's your hands. And you want to use a gentle cleanser. A lot of times even you don't need to use soap and cleansers every day on your entire body. You can just use it in areas that we sweat a lot. There's you know, there can be bacterial overgrowth like the groin, under the armpit, around the neck, places like that. And the rest just can be washed with lukewarm water, okay? Really important is avoiding frequent and long showers. And the reason, and hot showers. So frequent, long, and hot showers. And the reason, again, is very simple, that we are stripping away the natural ingredients that our body makes to keep us safe. And we don't want to do that. Like if you had like sticky, greasy stuff on a plate, you wash it with at least I wash it with hot water to get rid of it faster. And so you do the same with your skin. If you pay a little bit of attention, a lot of times I see patients come in, the worst part of their itch is right on their upper back. And the reason is because they stand under the shower with hot water on their upper back. So you want to try to avoid that. And the best time to put your topical treatments for the CTCL and also put moisturizer on your skin is the time when you come right out of the shower while your skin is damp, so you can put the moisturizer on and seal that moisture onto your skin. That's the most effective way to take care of your skin. And this is talking about different moisturizers that we have and why we like what we like. But up to this point, any questions for me? Okay, I'm going to quiz you at the end if you don't ask questions. Yes?
Could you go back to the slide that has the ingredients so we can take a picture?
Yeah.
That one. Thank
Yep.
you.
And this is like limited, you know, there's tons of things out there, but it gives you a general idea.
I have a question from the online.
Yeah.
I'm over here. If you wanna
Yes.
see what- So the first question is, would like to know if using DEET against tick and other bugs while hiking will further hurt my skin.
Well, it depends. It always depends. So if you are putting it on irritated skin, on diseased skin, I would not recommend that. But if you're putting it on normal skin, then I would say it's okay to put it on normal skin because you want to protect yourself from the bug. There's a lot of side effects and irritation, extra irritation, that you can, your normal skin or your diseased skin get from the bug. And also, again, like there's, even with those type of like bug repellent, right? There are ones that are non-chemical, and there's also clothing that are bug repellent. So those are other things you want to consider. Okay, so my favorite like type of moisturizer is ointment on a wet skin, because ointment prevents moisture loss. And pure ointments like petroleum jelly cannot add moisture to your skin. So if you put it on a already dry, irritated skin, your skin constantly is trying to moisturize and produce more moisture, but it won't be as effective as if you put it on a dry or damp skin. Does that make sense? So it can seal and keep the moisture on your skin. Lotions or ingredients, that have we call humectants, like glycerin. Hyaluronic acid is a little bit controversial, but like glycerin, they try to hydrate and draw moisture into the skin. They are nice. They're effective. A lot of times they're available in creams. And the problem that we have with creams or emollients is that they have preservatives in them that can irritate an already irritated skin. Also, they don't stay as long as ointments on the skin, and so they need frequent reapplication. And so that means also more frequent exposure to the ingredients that could irritate an already irritated skin. Okay. I think something that we didn't write here, but I always explain to my patients is that anything that comes in a jar or a tube is much better than things that come as a pump in a pumpy form. And the reason for that is that pumps, many of these pumpy stuff, they have alcohol in them, an extra ingredient for it to like come out of the pump. And so alcohol dries already a dry skin. So patients use, these pumpy lotions and they're fine with it, but that just because their skin is already close to normal, right? So we need extra care for skin that is diseased or skin that is irritated and super dry. This is basically what I just talked to you about. I like that photo up there that shows you, the water versus oil-based content of different, what we call vehicles, right? Like lotion, cream, ointment, Vaseline, which is pure petroleum jelly. Very good. So this is also like, I touched base on that. Again, we like ointments better because they provide or prevent moisture loss, but they're sticky. And a lot of our patients work, and they don't want to put sticky stuff and then wear their nice white crisp shirt on top of that. I mean, if that is the case, I rather, you put whatever you think works for you, rather than not to put anything. And so this is a discussion we have even more with men than women because they particularly don't like sticky stuff. And, if I give you something and you're not putting it on, right? I mean, what's the point of me giving it to you? So I rather you tell me what you use, and then I'll figure out the best way or the best vehicle to make it work for you. So given I personally don't like lotions and solutions, but if you tell me, listen, if this does not get absorbed in 2 seconds, I'm not putting it on. Then we'll try it, And either sometimes they're like, oh my God, that stung, and there's no way, okay, give me the ointment. Well, then now we know, right? We learn as we go. So most important thing is that you put something on your skin. And then if you want to optimize it, this is the way to go, okay? And when we are trying to moisturize irritated skin or diseased skin, remember to always put the prescription topical treatment on first, like is it topical steroid or whatever it is, and then put the ointment on top of that. And so this way, the ointment can seal the topical treatment that is, in a prescription form like topical steroid onto your skin for it to stay longer. If you put your topical steroid on top of the ointment or moisturizer, then it cannot penetrate into your skin. again, a nice summary of, you know, how to use moisturizers. You know, for a lot of our patients, we recommend they get lotion back applicators. They're readily available online and in stores, which is basically a sponge on a stick. I also recommend it for my patients that have a lot of itching. You know, a lot of them come with back scratchers, and I'm like, you know, if you love this, just stick a sponge on it, put Vaseline, and every time you feel itchy, just put that on instead. Most recently, yesterday, I was were you with me? Yesterday in the hospital, and one of the patients had taken a stick and put like one of those, like a hairbrush, and duct tape it on that stick. And it was like scratching the back, and I'm like, oh my God, please stop. She was very proud of her device, but not good for her skin. So I asked her to get one of these instead. Go ahead.
When you talked about putting the ointment on and then putting a moisturizer on,
Mhm.
does that go, are you talking about if you use nitrogen mustard, is it helpful to put a moisturizer on top?
Very good question. So
Could you
nitrogen.
repeat the question first? I'm sorry, so that online can hear
Oh,
it.
yes, yes. So the question was, how about when you're using nitrogen mustard? Can we then put ointment or moisturizer on top of nitrogen mustard? So what happens when you put ointment or moisturizer on top of your prescription topical treatment, you make it more potent because it stays on your skin longer. And you have to be careful when you're using nitrogen mustard because it can start irritating the skin. And you don't want to, this is what we call occluded, right? You don't want to occlude nitrogen mustard because then you're more prone to get irritation on your skin. But if you want it to make more potent, then that's the way to go. Yeah. Very good. Any questions? Yes.
I just have a question. It's more for Susan.
Uh-huh.
No, I don't need a microphone.
Okay.
Is this going to be available online, like the actual slides? Because there's so many good things that I want to write down, but I can't do that.
So we are recording this while we're live streaming it, and it will go on our YouTube channel. It'll be there later next week.
Not the actual slides.
So that's actually, we have found most of our clinicians, you know, some of this is their proprietary information, and we don't really want it out and about to be able to be shared with others, especially if things get outdated. Is it okay to take pictures is one of the questions?
I didn't see it. I didn't say anything.
All right. So,
Again, what we do in this room stays in this room. Okay.
so
go
I have a
ahead.
couple questions from
Uh-huh.
online, if
Yeah.
we don't mess with your flow
Yeah.
too much.
No.
So someone asked earlier, does this all apply to CBCL also?
To CTCL?
CB, Charlie
Yeah,
Bravo.
absolutely. Absolutely. You know, up to this point, mostly we were on general skincare, but yes, if we're talking about lesional skin, yes, absolutely. Mhm. And-
Then next one is, we just use shea butter soap plain, and she likes your comments on the ointment. And I'm not sure if this is a question that you can address at this point, is can MF cause sweats as well?
Like extra sweating?
Yes.
So it doesn't cause extra sweating under the arms or going, you know, if those areas are normal skin. And it doesn't cause extra sweating where you have the MF lesions. But what can happen is that you can have night sweats or chills, depending on how much body surface area is involved and how much heat and moisture you're losing. So that can present itself maybe as like sweating, but it's not really extra sweating. Okay. Sunscreens. Even MF patients, CTCL patients, or cutaneous lymphoma patients need sun protection, okay? Again, when we give phototherapy, we are giving one narrow wavelength of the sun, The rest you're protected from, and it's a controlled environment that we have decades of data on. So I never recommend that you just go sit in the sun because phototherapy is good for your MF. Okay. That said, as I mentioned in the previous session, again, don't ever mention that your dermatologist or a dermatologist said that, but getting a little bit of sun for patients that are not at high risk of skin cancer on their on their MF skin, if it's not at the, at the time between like 10 to 4, where the wavelengths are the worst, it's okay to get to be 10 minutes out in the sun. And not every day. But much better is you get phototherapy, controlled environment, and wherever you don't have disease, especially in the face, even with phototherapy, you can wear sunscreen or cover it. So sunscreens, before we would say it just has to protect you from UVB. Now we know better that UVA is also can be not only increasing risk for skin cancer, but also it can increase risk for skin aging. And the SPF that we usually recommend with the data we have is SPF 30 and above. And we used to say, oh, 30 and above is great. And still is, for the most part, daily use is really good. But we know that when we tested the sunscreen with different SPF in a controlled environment in the lab or in clinical trials, like where we know exactly how much people are putting, yes, that works. But in real life, none of us is putting enough sunscreen on to give us that protection factor. So it's important to put a nice thick layer of sunscreen that is SPF 30 and above. It's important to reapply the sunscreen every 1.5 to 2 hours when you're in the sun. Physical sunscreen versus chemical sunscreen. I get that question in clinic a lot. Really short. I put whatever sunscreen I can find on myself and my kids. Whatever comes first, I just put it on, okay? Because that is the most effective one. There is a lot of controversy about chemical sunscreens. All the data that we have up to this point over decades is inconclusive. The ones that showed toxicity was that they gave the chemical ingredient to the mice to ingest. First of all, we are not mice. Secondly, we don't ingest sunscreen. So it just doesn't apply to us. Now, a couple of years ago, there was 2 studies that showed that maybe some of the sunscreen ingredients do get absorbed to the bloodstream. Now, again, these studies are very complex and have a lot of confounding factors, and they're hard to study. So it's still very hard to say, how long do they stay? What time after the absorption, was that measured? How much sunscreen, was it realistic, the amount of sunscreen they put on patients for these studies? And even if it gets absorbed, puts us at higher risk for any type of, carcinogenic evolution compared to being at risk for skin cancer. So there's a lot of questions on that. So I use whatever sunscreen I find. Also for my kids, I do the same, except like for infants. But otherwise, physical sunscreen is what we have in the US is titanium, and a dioxide and zinc oxide, okay? Those are the 2 physical blockers we have. And then you can see like a couple of the benzons on the chemical sunscreens. And we have other type of ingredients that are chemical blockers. And I like this one. The difference between physical, what we call a physical sunscreen, is that it physically blocks the sun penetrating your skin. So titanium and zinc does that. So you can imagine, for it physically blocking, it needs to have that little white residue, right? Like to know it's actually like physically all over your skin, okay? chemical blockers, but by that chemical reaction, avoid the absorption of the sun wavelengths into your skin. Okay. One more thing. A couple years now, I think 2021, the FDA came out with a report that 90% of spray sunscreens have benzene in them. And benzene is a known carcinogen. So, and it's in the vehicle of the sunscreen, not the sunscreen ingredient. So if you're getting spray sunscreen, first of all, if you're getting spray sunscreen, make sure, and you're spraying sunscreen on your skin, you still rub it in. Otherwise, it doesn't work well. And then second is that make sure it's benzene free, because that's easy to avoid. And this is, again, a lot of the things we talked about. Any questions? Yeah.
Two questions, if I may. The first one is, can you tell us what your shaving regimen is? Can you tell us what your shaving regimen is? And secondly, I've been hearing a lot more recently about skin, dry skin, flaky skin, skin sloughing off. People seem to be having a lot of problems with that. I am. And I find that I get relief sometimes. I don't shower every day like you recommend and all that. But I find I get some relief sometimes by using a loofah or something that takes some of the buildup of dry skin off. That seems to run contrary to what you were suggesting. Similarly with shaving, I can't dream of shaving without using hot water. I don't know what to do about that, but I do get flaky skin as a result of that. So if you could address those 2 points, it would be great.
Great questions. I'm not sure if I understood your question, the first question correctly, but it was a personal question. I shave twice a day. And then but if you meant in general, so hot water, there's like a couple of things, right? Like using maybe moist, hot, or warm towel, right? And leaving it on for a few minutes. That sometimes can be helpful. If hot water cannot be avoided, then using a nice thick moisturizer on wet skin immediately after can be helpful. Okay. I don't know if you're reading more about dry skin because you have dry skin and you're reading more about it, or people just have more dry skin. The CTCL community. So for sure, dry, flaky skin, I absolutely do not recommend using a loofah, because every time you try to scrub your skin, you are also, first of all, traumatizing your skin. So when you traumatize your skin feels attacked and tries to defend itself and does all sorts of weird things to try to defend itself, but nobody's really attacking it. So that's number one. Number two, depending on the irritation, the dryness, flakiness, is that if you're trying to scrub things off and take scales off, you are also taking off the new skin that is trying to come in at the edge of the scale. So you are slowing down wound healing, okay? So what we want to do, we have, and it's not in these slides, but I can talk about it here. What we want to do is that in those cases sometimes we use ingredients, what we call our keratolytic, that gently take care of that dry, flaky skin, okay? Now, if this is CTCL, disease skin, then we need to treat the disease, right? That's the way to take care of the flaky, scaly skin. But also a lot of patients have dry skin on top of that, or what we call they have also, you still have your normal skin, right? So you have still seborrheic dermatitis and other things going on. And for those, we use keratolytics, and keratolytics are like salicylic acid shampoo, salicylic acid body wash, salicylic acid face wash, or amlactin, which is ammonium lactate, or urea. Moisturizers that contain urea can help get rid of that flaking.
Dr. Rozati?
Yeah.
A question from online.
Uh-huh.
Is the use of natural aloe good?
You know, natural aloe, like, you know, I have patients that cut the plant and take that out. If it doesn't irritate your skin, as I briefly alluded to, a lot of the natural ingredients irritate the skin. They are what we call allergens, so you can show an allergic reaction. And you're more prone to show allergic reaction if you don't have intact skin barrier. So you have to be careful. If you've been using it, you like it, again, like we have to, you know, do risk benefit. If you like it better than the Vaseline, you're not going to put the Vaseline, it's not hurting you, sure, go for it. But certainly what they're like, oh, but this is a organic, natural, no. Okay. That was one question. Oh, the other thing on that natural thing, something I do like though, and again, like only on certain circumstances because it cannot add moisture, but it can keep moisture, is if you're looking for natural products, is cooking grade coconut oil. If you put it on wet skin, especially in summertime when you're looking for something lighter, that can give you, that can be moisturizing. Go ahead.
Can you speak about deodorants? And I always see aluminum free, and honestly, I have no idea why a lot of things are aluminum free now.
Because we need to sell things.
Right. So I just wanted to understand more about deodorants and
Yeah.
kind of what to use in that
Yeah.
aspect.
So deodorants, you know, when you have normal areas, if we're talking areas you have normal skin, then normal skin regimen applies to you, right? Some people have aluminum sensitivity, right? They're allergic to it, then they should not use it. Or for whatever reason they cannot tolerate it, they should not use it. But for the rest of us, you know, we just don't have enough data, like if aluminum does something to us or gets absorbed or is carcinogenic, or I don't know what the story is out there. But for the rest of us, you can use whatever deodorant you want. Now, sometimes, again, when the skin is irritated, right, is involved, or you had an allergic reaction to something else, then what I recommend is minimal ingredients, right? Or even, ideally, even no, like sometimes patients cannot use even any deodorant, aluminum-free or not, until the skin is completely healed.
Just out of curiosity,
Uh-huh.
you mentioned coconut oil. What about castor oil?
Castor oil, you know, I don't have personally that much experience with it, and neither like have I seen many patients on it to observe any specific pattern. But you know, that's like pure castor oil, topically applied, is just like the aloe. If it doesn't hurt you, it's okay to use it. And again, remember, oils are not moisturizing. They prevent moisture loss. So if you want to get maximum benefit out of it, you have to put it on wet skin.
I apologize if you've covered this already, but can you speak a little bit about bug sprays?
Yes, we did cover that.
Okay, I'm sorry.
So I'm going to have you listen to the video and quiz you at the end of it. So bug sprays, again, like if you use it on lesional skin, right, like where you have the MF, it can be extremely irritating, okay? But if you want to use it on your normal skin to prevent bug bites, then that's okay, yeah. Topical steroids. We also talked about this a little bit already. So topical steroids are like an important part of our regimen, right? If you have advanced disease, early stage disease, regardless, we are giving you some topical steroids. And again, the same way we talked about the different vehicles of moisturizers, we love ointments the best because they stay longer on your skin, they don't have those preservatives, and they just work better. Sometimes areas we don't like ointment is thin skin, right? Because of those, exactly those things I just mentioned, sometimes it can, then you get, you're more prone to get the side effects with frequent usage. So that's one reason sometimes we give creams. And sometimes, again, if patients say, I'm not going to use ointment, well, then we give you the cream. But otherwise, you know, we have different strength topical steroids, different formulation for different body areas. I personally don't like foam solution lotions just because, again, they have extra ingredients on alcohol in them. But sometimes for the scalp, we need to use a lotion or a solution. And then when you're putting it on, you're first putting your topical steroid, then the moisturizer on top. So this is just, you know, I think this is what your question was, right? Like about nitrogen mustard. So you don't want to, and that's about the timeline that it takes to absorb the topical treatment before you put moisturizer on. And the reason we don't put the moisturizer on immediately, we already talked about. This is basically the summary of what we talked about, right? You first cleanse your face, your body with a gentle cleanser, areas that needs to, you know, come in touch with soap. Then you just damp dry the skin. Then you put your prescription topical treatments on. And then depending on if it's, you know, if it's like nitrogen mustard or imicamod, you wait or don't put anything on. And if it's topical steroid, then you put your moisturizer on top of the topical steroid. And you see like how to use the sunscreen. This is something general, you know, again, because of our patients, mycosis fungoides, Sézary syndrome, they have a lot of lesional skin that does not have normal skin barrier. We, in general, recommend that they use hypoallergic stuff. So hypoallergic detergent, hypoallergic moisture, minimal ingredient moisturizers. Do not use fabric softener or dryer sheets. And again, the reason is that regardless of MF or not, even patients with atopic dermatitis, when the skin barrier is not normal, you're at a little bit higher risk of developing allergic reaction to ingredients. And, you know, that can cause itching and further skin irritation, which in MF can look like just like progression of disease. This is very important. Keep your fingernails short, especially if you have itching. Keep your fingernail super, super duper short. Because a lot of the scratching happens in sleep. And so even if you like, but I don't scratch, I don't know why my skin is looking like this, it's because you're scratching in your sleep. So try to keep it, I sometimes even tell my patient to wear cotton gloves at night, especially if we cannot control the itch immediately, to wear cotton gloves so to protect their skin from themselves. Any other questions? Yes?
Is there anything that can be used to strengthen the skin, to make the skin thicker if it's too thin, or healthier in some way?
Yeah. All these that we just talked about.
What, like collagen,
No.
peanut butter?
So peanut butter, you could, right? Because it has a lot of oil. The problem is you can show an allergic reaction, yeah. Go ahead.
So our online question, they're asking, is baby shampoo and wash with ceramides safe?
Yes. I mean, it's not like baby shampoo is not better than, you know, and I don't want to name any products, but like a Dove soap bar, unscented Dove soap bar. So sure, yeah. Any other questions? Okay. My favorite, after Vaseline. bleach baths and vinegar soaks. We use it for our patients a lot. We use it, and at first time patients hear it, they like freak out. Bleach bath? I'm not going to put my skin in bleach. And you shouldn't. We're not talking to directly, pouring bleach on your skin, but a very diluted bleach is extremely helpful for diseased skin, for dry, flaky, red skin. Because, again, the skin barrier is not intact, you can have bacterial overgrowth on the skin. And that bacterial overgrowth, first of all, can cause infection that can get into the bloodstream. But also, secondly, it can cause tons of itching. And so bleach baths 2-3 times a week are extremely helpful to calm down the skin by reestablishing the bacterial overload. And also, studies, which I'm not going to discuss here, have shown that bleach, not vinegar soak, but bleach decreases inflammation. And so for those reasons, we use bleach baths and vinegar soaks a lot for our patients. But remember, you can overdo it. So just go with the guidelines of your physician, and don't overdo it, because it has its own problems. Sometimes my patients feel the benefits so much, and they think like if they do it more, they will get more benefit, but it doesn't work like that. Okay? Yes?
When you talk about bleach, laundry bleach?
That bleach. 6% sodium chloride. Yes. No fancy bleach, no extra bleach, no lavender organic bleach. I'm sure gluten-free bleach. Just bleach, okay? Just regular bleach. The same with vinegar, just regular white vinegar. Doesn't have to be red wine vinegar, champagne vinegar, just vinegar, okay? All dermatologists are familiar, because we use it for infants and kids with atopic dermatitis a lot. So all your dermatologists know exactly how to recommend this, or at least should know. So what we do is that we use diluted, and I think the dilution is in the next, let me go to the next one, next slide. We use diluted bleach in lukewarm water, and if you have a lot of skin involvement, then we ask you just to go in a tub, sit in a tub for 10-15 minutes, right? You don't want it to get it in your eyes or mouth or nose. And then you get up, just rinse yourself with water. You don't want the bleach to sit around. Vinegar is okay, but bleach can get itchy. So you just rinse with lukewarm water, and then while your skin is damp, you put your creams, your treatment creams, and then your moisturizers. And what we do for kids, which I feel like adults don't like it a lot, probably kids don't like it either, but they don't have a choice but to listen, is what we call wet to dry dressing. So another way to add moisture, right, is you put all these creams and moisture on, then you wear damp, little bit tighter, long sleeve pajamas. And they actually sell them online specifically for that reason. Different companies have that. Cotton long sleeve pajamas on top of your moisturized, greasy skin. And then you wear a set of dry long sleeve pajamas on top of that. And sometimes when the skin is very compromised, I do recommend that for our adults as well. And have them, if you can tolerate it, for kids, we say sleep with that. But, even if you can do it for a few hours, it can make a big difference.
Hi, so my question goes to overdoing the bleach bath. So in a few weeks, I'll be opening my pool. And I chlorinate my pool to the high end of the acceptable range,
Okay.
10 parts per million. But it's still within the acceptable, but it's a larger chlorine load. And I know that the bleach the bleach bath is similar to taking a dip in a chlorinated pool. So how do I know if I'm overdoing a bleach bath protocol during the summer, this summer when I'm swimming?
So that's a good question, and it's hard to answer because we haven't done any studies on it, and we just go evidence-based. I can talk to you about things I have evidence for, but in general, so what I would say is that when people ask me, can I go to the pool? Yes, you can. It does not hurt your skin. Is it just like bleach bath? No, it's not. It's not the same concentration, not the same way we do it. So you're welcome to do, to use the pool, and then if you still needed to do bleach baths.
What does a bleach bath overuse or overload look like?
So you won't see it, but I will. And the reason is that not so many bacteria, fungi are susceptible to bleach, but some are not. And so if you overdo it, you tilt the homeostasis of that balance between the good bacteria and the resistant bacteria. And then those resistant bacteria can potentially overgrow and cause infection.
So perfect timing.
Fabulous. Yes, and vinegar soaks, very, very similar. Little bit different dilution. I usually say 1-to-1, 1-to-2 dilutions between vinegar soaks and lukewarm water. A lot of times we use, vinegar soaks when I think there might be a little bit of yeast overgrowth on the skin. It works better for yeast, I think. And so we do that either feed in a basin, or if you don't have a bathtub, with bleach bath or vinegar soaks, we ask our patients to put clean towels, soak them into the diluted vinegar or the diluted bleach, and then leave it on those areas of skin that need it. Leave it on for 10-15 minutes, and then rinse it off. That's also what we do for our patients in the hospital. Old days, when dermatology had their own floors in the hospital, we had bathtubs on the floors where we would do that for different conditions. But nowadays, we don't. And that's what we talked about. Vinegar soaks, so just your, vinegar that you find anywhere, nothing fancy. So 1-to-1 or 1-to-2. And if it's irritating, 1-to-3, So enough that you can tolerate it. Vinegar is a little bit easier tolerated than bleach. There you go. Okay, I think this is the last stretch, is wound care. Wound care is very complex, complicated. It depends on the type of the wound. It depends on the type of lymphoma. I mean, there's a lot involved in it. And so this is extremely brief and simplified. But just so to start the conversation, is that wound care is extremely important. A lot of the wound or that ulceration and discharge is on the tumors or on the CTCL, on the disease, on the skin itself. And so the main treatment is the treatment of the disease. But good wound care can facilitate healing of the skin, as well as ensure that you don't get superimposed, you don't get superimposed infection, and so on. So these are like simple signs to look for a wound infection. When do you know that your lesion, your CTCL lesion or disease is probably infected, or anywhere else in your skin is infected, right? So increased pain, increased redness, having like yellowish, grayish discharge from the area, for it to be foul smelling, and obviously, I mean, fever, chills, and so on. These are very basic stuff that we need for sure for wound care, but then the rest, it really depends on the type of the wound, right? A lot of times we need to use topical antibiotics. We still need to use some sort of an ointment on top. A lot, and I'm talking here particularly in using ointment on top is for CTCL patients, not every wound. And then non-adherent pads are very much more helpful than the regular gauze. And then paper tape to put that non-adherent tab. And then we have a lot of fancy dressings like Mepilex dressings and foam dressings that we use in certain patients for certain wounds. I also love these tubular elastic net dressings. We use that a lot in patient to, because we see wounds in all sorts of places that is hard to make it the dressing stay, and those tubular net dressings can be very helpful. Some of this is you already know, just gentle soap. Always even an infected wound, you need gentle soap. You don't use harsh soaps on even an infected wound. Okay, because for that, we use bleach bath, we use antibiotic ointments, we use other things to get rid of the infection, but don't use harsh soaps. And again, do not scrub off anything on your skin. Very good. And this is just like the, how to proceed with your wound care, right? After cleaning, then you want to cover it. You put your ointment, antibacterial ointment on, then you cover it with a non-adherent gauze. You want to avoid wrapping it too tightly. For sure, because then you compromise wound healing. And the dressing change really, really depends on the type of dressing that you're using. So some dressing changes need a few times a week, and some need every day, twice a day, and that really depends on the wound. Okay? And then if you have lower extremity swelling, which a lot of our patients do, compression stocking is key, and leg elevation, but compression stocking. And I love that device. It's extremely helpful. It's called a Butler, and you can order it online to help you put your compression stockings on. The best time to get the compression stockings on is first thing in the morning before you get out of bed. Because that time, the swelling in your legs are at their minimum. And these are my fellows who did all the work, and I just had the fun in presenting it here for you guys. Thank you.
And perfect timing, I think.